May adlaw na tong tanan. Does your arm look like this? Bent, spastic, or tight after a stroke, and you want to be able to straighten it out and regain function? If so, then you are in the right place. In this video, I'm going to show you simple but effective exercises and stretches to straighten out that bent stroke arm. And this program will help you improve your range of motion, prevent spasticity or contractures, and help you reduce stiffness and pain. Hi, I'm Nathan. I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. In this program, we will use a top-down approach, meaning we'll be starting from our shoulder going to our wrist and hand. That is because even though your main goal or your main concern usually is to be able to use that hand, open or close it, and hold things, we need to be able to reduce the tightness or spasticity of our shoulder, our elbow, and our entire arm before we can use your hand, because you won't be able to use your hand if you can't reach it, right? So we need to mobilize your shoulder and your elbow and forearm before we work on our hand. So again, we will be doing a top-down approach in this video. So enough talking, just follow along with me. Alright, for this video, my stroke arm will be my left side, the one with the arm sleeve, okay? So your arm will be like this if your affected arm is affected by flexion spasticity, okay? So what you need to do is to go to your table and place your arm, even if it's still bent, the elbow is still bent, place your arm on the table and slowly look for your chair, sit down, okay? Once you're there, just move around, bearing a little bit of weight on your elbow and move side to side. All right, go side to side and then go forward and back. So when you go back, you will see your armpit opens up like that, right? When you go away from your arm, your armpit also opens up. But go slow for a few seconds, about 30 seconds to a minute, okay? Now once your shoulder is a little bit more mobile, you can scoot back towards your chair and lean away from your arm. Again, that will stretch your shoulder even more, all right? And if you can tolerate it, look down and bend down. That will really stretch your shoulder. Hold it for a few seconds, minimum 30 seconds, okay? So do it that way, and then slowly come forward, okay? Come back if you can. The key is do not go fast during the stretches because you don't want your tight and spastic arm to bounce back, okay? So just hold it for a few more seconds and then go back, all right? Now, we are not just going to stretch our shoulder up, right? We also need to stretch it back, all right? Usually, our chest muscle is also very tight. It's hard for you to open up like this, which is also a big component in reaching up, right? So you need to stretch your shoulder, or rather your chest muscle, and massage it just a little bit, like that. And then what you need to do is scoot back and try to bring your affected arm, your stroke arm, back towards your armrest. And then slowly move away. Okay? Away from it, and you will feel a good strong stretch on your shoulder. Hold it for about 30 seconds to a minute. Again, go slow. It might be painful at first. You might even have pain on your deltoid, or that big muscle there at the topmost portion of your arm. So just go slow, all right? Go away. If you need to, massage that area and your chest. Go slow, all right? And then come back, slowly come back, lean towards it. Assist your stroke arm to come forward again, and then back on the table. Because the next area we need to stretch is our elbow. All right, so we are going to stretch your elbow now. So what you want to do is to bring that forearm flat on the table. Okay? Go slow again, go slow. Now, if that is all that you can do, just keep it there. Okay? Rest your other elbow towards the table and just keep it there for a bit. All right? Let gravity be your friend and slowly bring it down. Again, do not force it because it will just go back. Okay? Just go slowly. Just like that. Okay? Slow. Look, my hand is even bouncing around because I'm forcing it. So again, I should be following my advice. Go slow. Alright? So once your forearm is flat on the table, you just also need to work on bringing that forearm to face up. Okay? So it's still like this, facing down. Work on that forearm to face up. Go slow. Hold it for a few seconds. Like I said, 30 seconds to a minute. And then come back. Right? So let's do it one more time for about 30 seconds. If you need to, just pause this video and then come back. By the way, I'm going to do an attendance check later on, so stay with me, follow along with me, and type down below my attendance check, all right? And then come back. Now I'm going to show you a bonus tip on how to keep that elbow straight. Okay, so now you have stretched your elbow and made your stroke arm or affected arm straighter. What you can do is to get you an ear splint. I'm going to leave down below a link. It is easier if you have somebody to help you use this thing. So I'm going to use my stroke arm now because it is really difficult to use this by yourself, all right? So you have here a tube that you can blow air in. So put your arm through. Have somebody help you with this. I like the long one because it will go up to your hand. If you're able to get your hand open, much better. All right? So there is a zipper here. Zip it up. Again, I hope that you have somebody to help you put this on you. All right? Now you can blow air in through the tube. Open it up, and then blow air. And then push that lock to keep the air in that air split. And you'll see you are able to effectively keep that stroke arm straight as possible, right? Then, when you're able to do that, you can do isolated shoulder exercises, right? Might be hard on a table like this, so you can put a towel under it and you can push and pull, right? Then you can also go side to side. So this is very effective in keeping that arm straight while you're doing isolated shoulder exercises. And I'm going to leave you a link down below in the description area where you can get it, okay? So again, get you an air splint. It is a really good investment if you are serious in getting that stroke arm straighter, and leave this on for about 1 hour. All right, now next we're going to try to extend our wrist. So the wrist is like this, it's also bent down. We need to straighten it out. So we have worked on our shoulder, we have worked on our elbow and our forearm. So our forearm should be a little bit flatter on the table now, right? So our wrist is still bent, our wrist and hand is still bent and closed. So what you want to do is to go closer to the end of your table. Use whatever you got, right? So if you have a movable table or a portable table, use that. Or better yet, use your dining table, which is more stable, okay? So bring your wrist towards the edge of that table and then slowly bring it out. But there's a key here. It will be your thumb. So your thumb is like this, or it could even be inside, right? So the key is the thumb. We need that thumb to open out like this, all right? So open out like that is the key in order to get your wrist and hand to open up. So try to stretch that thumb out very slowly. Again, slow, 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 and bring it over the table, okay? You can stop it with your other hand and try to insert your other fingers inside that stroke hand. Very slowly again. It will take time. All right? And try to go towards the tip of your fingers. Very slowly, very slowly. And at the edge of your table, just hook your fingers there, right? And then assist your stroke arm or your affected arm out. Out. Very slowly. Slide your entire forearm and your entire stroke arm back towards you to open that hand and straighten your wrist, okay? Just like that. Again, very slowly, very, very slowly. If you need to pause this video again, pause this video. And while I am stretching my fingers, my hand and my wrist, I'm going to do the attendance check. So type down below, intentional, intentional. So just like doing the exercises for your stroke arm, we need to be intentional in our movement. So type down below, intentional, for your attendance check. All right, so once it is flat on the table, what you need to use now is a splint like this. All right? Again, I'm going to leave a link down below so that you can find this splint. I like this one because it keeps the thumb out and away from your hand. All right? You don't want it like this, your thumb to be stuck like that. We want it to be open like this. All right? So after holding this position for about a minute, get your splint. Ask somebody to help you because this is so difficult to do. Right? There's a lot of Velcro. So it is necessary for somebody to help you do this. All right? So I'm going to just put my hand, my stroke hand through. And what I like to do is to attach the middle part first. Lock it in first. The one that secures the middle of your hand. And then I'm going to work on my wrist because not the wrist but my thumb, because the thumb is the key to opening up that hand. All right? Then I go to the fingers. This is how it should look like. Now keep wearing this. Keep wearing your splint for about an hour to start with. If you can tolerate an hour, there's no redness whatsoever, wear this for 2 more hours. No, I mean another hour to make it 2 hours, okay? So you really need to use this. Now once you have this on, try to work on that elbow. Try to do some isolated exercises there. Do some isolated exercises for your shoulder in combination with your elbow so you can stretch up, then come back down. Try to reach up, come back down. Open that underarm to reach out and away, sideways, and then come back forward. Again, intentional movements, okay? So this is how you stretch your shoulder, elbow, forearm, wrist, and hand. All right, there you go. Those are the exercises and stretches for you to straighten out that bent or curled up stroke arm, your shoulder, your elbow, your wrist, and hand. You need to do these exercises daily before you do the other exercises for your arm for strengthening. And again, the minimum requirement is 30 seconds hold for each stretch. If you find this video helpful, please click on that subscribe button, give it a thumbs up, and click on that notification bell. In order for me to grow this channel and reach more people who have difficulty finding a therapist or who have been discharged from therapy, and they want to improve even more, okay? So if you have any questions, suggestions, or comments, just type it down below. I'll try my best to answer all of them immediately, but I'm sorry if I'm a little bit late because I am still a practicing occupational therapist. So again, just a reminder, consistency is the key and never give up. Until next time, paalam!